what do you say to those people who are saying, why am I going to wear a mask now when you told me not to earlier?
Yeah, and I do understand that must be confusing to people because the message did change. There are two reasons somebody might wear a mask. One is to protect themselves from what might be virus in their vicinity. If you're a healthcare provider giving care in the emergency room with people rolling in the door who might have COVID-19, you need to be wearing PPE, including a mask. But that needs to be a mask called an N95 that is designed specifically for you to limit the ability of that virus to get into your respiratory system. That's one kind of a mask. The Surgeon General was arguing, I think appropriately, 2 or 3 months ago, that people who are not in the healthcare system really shouldn't be going to try to find those N95s because they were in very short supply. And most of us were not in a circumstance where that would be justifiable just because of the need to be sure the right people got those masks. This is a totally different idea. That is, I should now wear a mask so that I'm not infecting somebody else. It's not to save me, it's to save them from me. So it's flipping it around in terms of the rationale, and it's based upon this new data about COVID-19. If you think about it that way, there's nothing here that's not consistent. It's just based upon new information that we've been gathering over the last 3 months.
And did health experts overstep in recommending against masks? Did they talk too definitively about that, or did the information that we have about the spread of COVID-19 and the droplets, was that really the determinative factor in the change in guidance?
My friend, the Surgeon General Jerome Adams, who spoke very strongly about encouraging people not to go out and get N95s, was doing exactly the right thing, trying to preserve a precious resource for those who needed it most. And at that point, we didn't really appreciate how infectious people might be without symptoms. We kind of figured if you're walking around and you're feeling okay, we don't need to worry about you. We don't think that anymore. Probably 40% of the new infections with COVID-19 are derived from people who had no symptoms at the time they passed the virus on. That wasn't clear until some time had gone by. So it really does reflect a change in what the public health needs are. Masks certainly are still needed for healthcare providers to protect them, but for the rest of us, we need to protect people from us. Wearing that mask, and it doesn't have to be a fancy N95, just a cloth that blocks those droplets. That's what you need.